joining us today, it's likely because you or someone you know, whether that be your child or any students that you work with, are interested in a career in family medicine. You probably have questions about what being a family physician entails, what the post-secondary pathway into this career looks like, and what it's like to work in a rural setting. Well, I'm very honored to introduce you to our wonderful speaker who is here to answer those questions tonight. Chantal Schultz is a second-year medical student at the University of Alberta. She's originally from a small town in rural Saskatchewan called Weyburn and hopes to one day practice medicine rurally. She is the rural lead for the MD Ambassador program, where she helps connect rural high school students with more information about what it takes to become a physician. Chantal, I'll let you take it from here.
Awesome. Thank you so much for that introduction. As Emily said, I am from a small town, and so rural medicine is something that I care about. Um, I today am going to share with you guys a presentation on how to get through the pathway to medicine. So if you're here, like Emily said, you are probably thinking about a career in medicine. Um, we already did a territorial acknowledgement, but I just want to acknowledge again that the University of Alberta, its buildings, labs, and research stations are all on the traditional lands of the Indigenous people. So, if you're interested in being a physician, you may or may not be aware that there are a tons of different types of physicians. Today, we're going to kind of be focusing on family and general practitioners, which is a lot of what happens in rural medicine, but there are also a lot of other different types of physicians that we work with and that you can practice to become. There also, if you decide that strictly going into medicine and being a physician is not for you, there's a ton of different other healthcare providers and professions that you could become. And we work closely with all of these people as doctors. So people like dentists, medical laboratory scientists, nurses, pharmacists, all of those different type of people are people that we'll work with. You may or may not be familiar with this building. This building is actually the Faculty of Medicine and Dentistry at the University of Alberta and the hospital, which we do a lot of our studying at. Um, Something you may not know about the Faculty of Medicine and Dentistry is there are 20 departments and 8 research groups that are within the Faculty of Medicine and Dentistry, and there's other programs beyond just medicine within our program, such as radiation therapy, dentistry, dental hygiene, and medical laboratory science. Once you go to medical school, we have 723 undergraduate medical students who are part of our program between year 1 through year 4 of the program. I'm currently in year 2, and there's 187 people in my year. We have 700 full-time faculty and 2,200 community clinical faculty. And our program is a 4-year undergraduate degree program. And at the end of this 4 years, you write a big test of everything that you've learned, and you graduate with a doctor of medicine and you become a doctor. We really focus on access, community, and belonging, and we really care quite a lot about inclusion and making sure that the pathway to medicine is equitable for everybody. So I just wanted to touch on 2 of the different programs that we have within our school. So the first one is the Indigenous Medical Dental Student Association. So that's both in the dentistry program and the medicine program. And it's students from a variety of backgrounds who are passionate about Indigenous culture and Indigenous health, and anybody is welcome to join that program who identifies as Indigenous. And then we also have the Black Medical Students Association program, which was founded in 2019, and that's also working to create spaces where people feel seen and heard, and they can talk to other people who share a similar culture and background. And that's through just our faculty, and they really care strongly about advocating for Black medical students. And now I'm going to talk a little bit about applying to the MD program. So this is something that there's quite a bit to it. So if you do have any questions, feel free to ask me at the end. I'll go over it kind of more overview at the start here, and then I'll go into some more detail. So I might answer some of the questions you have a little bit later in my presentation. And I'm just going to highlight both the academic requirements and the non-academic requirements. So to start off, to go to the U of A medical school, you need what's called a bachelor's degree. So that is any 4-year full-time program. And you do need the full 4 years to go to medical school. However, you can apply to medical school in between your third and fourth year of your undergraduate degree or your bachelor's degree. And it's a year-long application process. So by the time you finish the whole application process, you will also be done your bachelor's degree if you are doing a 4-year program. For your GPA, we have something that's called a CGPA. So you can look more into it on the MD Admissions website. But basically, they take your best 3 full-time years to calculate your GPA when you're applying to medical school. And for anybody who is an Albertan resident, the minimum GPA you need in your undergraduate degree is a 3.3. And if you're not an Alberta resident, your minimum is a 3.5. There's also this big test called the MCAT, which is something not everyone's familiar with. If you're still in high school, you might not have heard of it yet. But it's basically a test that's completely separate from your undergraduate degree, and it's on sciences and clinical reasoning. So the MCAT stands for the Medical College Admissions Test, and there's 4 sections of this test, and it is a 7-hour test, which sounds really scary, but you just write it one time, and then you have the option to rewrite it if you feel you could do better, but you only have to write it one time. So it sounds scary, but I promise it's not too bad, especially if you only write it one time. The 4 sections of the MCAT are the biological and biochemical foundations of living systems, which is just a fancy way of saying biology and biochemistry. Then there's the chemical and physical foundations of biological systems. So that's more your general chemistry, your organic chemistry, and your physics. Then there's the psychological, social, and biological foundations of behavior, which is all your psychology and your social sciences. And then the last section, which is the only section that is competitive for applying to medical school, is called the Critical Analysis and Reasoning Skills section, or CARS for short. So for the MCAT, all that you have to do is get a minimum 124 in each section. The MCAT has a little bit of a weird scoring system where it's not how many questions you get right and how many you get wrong. You're actually ranked against everybody else who writes your test. So the test changes every day. And so if the day you write the test, it felt really hard and you feel like you thought you studied more but it didn't feel like it went that well, there's a chance that the day you wrote was just a really hard day. And if everybody who wrote that day also felt that it was quite hard and didn't do as well as they had hoped, you might actually get a higher score than you think. So a perfect score is a 132. And then for applying to the U of A, you just need a minimum 124 in each section if you are from Alberta. If you are not from Alberta, the only additional requirement is that you get 128 in that critical reasoning section or the CARS section. And that's not ranked competitively. It's just a checkbox. So as long as you meet those minimum requirements, you meet that part of the component and they don't look at it any further. So you don't need to do better than that. You don't need to get a perfect 132 in every section. They just look that you meet those baseline cutoffs. Then on the non-academic requirements, so this is more where you get to kind of tell the story of who you are and what you've been up to. So within your personal activities, there's 5 different sections. So there's an employment section, teamwork, collaboration, and leadership, volunteer work, life experience and achievements, and personal highlights. Within those first 4 sections, you get to put a minimum of 1 and a maximum of 4 experiences. And those can fit anything that you think fits in that category. So for employment, that's work. And then for volunteering, that's obviously just experiences where you volunteered. But for the teamwork, collaboration, and leadership, and the life experience and achievements, it can be anything you think that speaks to that. So for me, for teamwork, collaboration, and leadership, I wrote about being on a sports team and being the team captain. And then for life experiences and achievements, I wrote about going to a sleepaway camp with work, which is technically employment, but it was one specific experience that I really wanted to talk about. And then in personal highlights, it can be anything that you think has shaped you as a person, that you think is something really important for the reviewing committee to know about you. Then you have a references section. For the references, you require 2 references, and those references, there's no specific person that it has to be. It's more about how they know you as an individual and how they can vouch for you. So lots of people will have a professor that they knew really well or that they did research with or something like that. I chose a coach and then my boss because I had known both of those people for quite a long time and they knew me in an interpersonal setting and a professional setting as well. So they were able to speak to who I am as a person and my ability to be on a team, my ability to collaborate, and all of those other things. Once you get through that first portion there with your references, your personal activities, all your academic requirements, 600 or so people will be invited for an interview, and I'll talk about that process a little bit later. But basically, what the interview is it's called an MMI or a multiple mini interview. And so, what it is, it's all done virtually still since COVID. But you go into a virtual room where you get moved from room to room, and there's 7 questions, and those questions can relate to anything to do with ethics or things going on in the world, or just how you would handle an interpersonal conflict or something like that. And then there's one station as well that's a panel interview where the interviewers will just ask you questions about who you are as a person, why you want to do medicine, why you want to do medicine at the U of A, and things like that. I mentioned earlier that we're really committed to making sure that the pathway to medicine is equitable, and something about that we really care about is reducing admission barriers. So we have 3 different programs that can help out with that. The first one is MD Aid. I believe the applications are closed this year, but they'll open again next year. And the MDA program is basically something where medical students, current medical students, will sign up and they will support people from diverse backgrounds in getting to medicine. They'll do things like interview prep, looking over your application, and just giving you general like mentorship guidance and helping you with the MCAT and how to prepare for that. Then we also have the MCAT fee assistance program. Unfortunately, the MCAT is not free. It costs about $450, I believe, to write it, but the MCAT fee assistance program is something that can either waive or reduce that fee program if it's something that you can't afford. And then there's also the medical school application fee waiver program. So every school that you apply to will have an application fee that's somewhere between $75 to $150. But this medical school application fee waiver program applies to many schools across Canada, and it'll help you either make that fee smaller or completely get rid of it if you can't afford to apply to medicine, because we never want finances to be the reason that you can't become a physician. We also have some special admission processes that I want to talk about. The first one is the Black Applicant Admissions Process, or the BAP program. And this is just a program for people who identify as being Black, and it's designed in consultation with Black faculty, Black students, Black community members, and they all are a part of the file review process to make sure that your background and your personal history is taken into account when your application is reviewed. There's also the Indigenous admissions pathway, where all eligible Indigenous applicants who meet the application requirements will be recommended for admission from the Indigenous faculty and Indigenous representation who look over those applications. And then the last one is the medical military training program. And so there are seats that are reserved to only eligible currently serving regular force members of the Canadian Armed Forces. And so that's a pathway you can go through if you want to practice within the military, or you're a current military regular force member, or if one day you want to go into the military army, and they'll actually help you with your fees for medical school. And then something that I think is really important that we talk about here, because we are here through RHPAP, I want to talk about the rural admissions program. So we have a specific process just for rural applicants where we have 30 positions reserved specifically for qualified rural applicants. And those rural applicants will be given priority for admittance to our new NAMP program, which just opened in this past year. So, this new Grand Prairie campus that we have is called NAMP, or the North, which is at the Northwestern Polytechnic School of Health. And this is just a place where we want to educate future physicians in northern Alberta, potentially closer to where they live. So a lot of rural people live around the Grand Prairie area. And so moving to Edmonton is a big ask if you come from a rural place. I come from a town of only 10,000 people, so moving to a city like Edmonton, where there's over 1 million people, was quite overwhelming for me. With NAMP, we just hope that people who want to practice rurally, but who don't necessarily want to move to the city, they just have an opportunity to practice closer to home and more in a setting that they're comfortable with. And the Northern Alberta Medical Program, it also just hopes that people will be interested in practicing rurally because they have such a great experience at their program. And this building here is the new NAMP is the Northwestern Polytechnic building, but that's where everyone takes their classes. And it was designed to prepare and support rural and regional generalist doctors, but that doesn't mean just family medicine. A lot of people take that as family medicine because we say generalist, but generalist just means people who are willing to do a wider scope of practice, which is what rural healthcare looks like, just because there are less doctors in smaller populations. And so that can look like family medicine, that can look like emergency medicine, general surgery, and a bunch of things like that. And this is our very first class here, the 2029s, which is the year that they graduate. And so these are the first 30 students to experience the NAMP program. This is just some photos from them at their white coat ceremony, which is something I'll talk about a little bit later. But yeah, it was just really great to have this inaugural program. And the doctor that you see on the left there, he's been huge in leading us to that program. So we get a lot of frequently asked questions about being rural and about NAMP in general. And so the first question that we often get is, I'm a rural applicant. Will I automatically go to the NAMP site? Absolutely not. If you don't want to go to the NAMP site, everybody has the option to apply for Edmonton, NAMP, both, or a preference with one, but happy to go to the other. And so if you're a rural applicant, but you actually live closer to Edmonton and you'd rather live in Edmonton for the duration of your medical school, you can absolutely put that in your application. If you're not a rural applicant, but you're interested in becoming a rural physician and you want to go to NAMP, that is also an option. Priority does go to people who come from a rural background and meet those rural criteria, but it's absolutely not a requirement. If there are seats left after those priority seats have been filled, you can absolutely go to NAMP. Another question we get is about your residency, which is something I'll talk about a little bit later if you're not sure what residency is, but it's basically what you do after you finish medical school. And people worry that residency opportunities will be limited because of going to NAMP, but that's absolutely not true. There's other places around the country who have had programs that are just done more rurally, similar to the NAMP program, and statistics show that they end up with the same residency match rates as people who go to big city centers like Edmonton. And then, will my classes at NAMP be in person or virtual? So, some classes at NAMP are virtual because you do them with the same classmates that you have going and doing the same program as you at the same time in Edmonton. But all of your hands-on skills and your small group sessions will all be done in person. I just wanted to go over the timeline again, just in case it got lost when I was going over the details of every individual thing. But basically, what that means is you're going to finish high school and you're going to go take a bachelor degree. This bachelor degree can be in any subject you want. A common misconception is it has to be in science, but there's actually no prerequisite classes for any science to go into medical school. The only prerequisite to show your science background is the MCAT, which, as you can see, is kind of after that bachelor degree. You can write it in between third and fourth year if you want to apply while you're finishing your fourth year of your undergraduate degree, but that's the only science prerequisite. So you can do your bachelor degree in whatever you want. It just has to be a 4-year bachelor degree program. And then you also do your personal activities that you'll write about on your application. So volunteering, schoolwork, summer trips, those types of things. Then when you're ready to apply, you're going to apply in October, the first week of October, usually on October 1st. But sometimes it's on October 3rd, just depending where the week falls. But in that first week of October of whatever year you're applying, that's when your application is due. And applications also, just for reference, open in July. So if you want to go to school in the following year, you can start your application in July and submit it anytime. It just has to be submitted by October 1st. And then if you're successful, 600 people get invited to do an interview in March. And then you find out in May if you're accepted. And then 1 year after you apply, you'll start your program. So for example, if you applied in October 2025 and you were successful, you would start your program in September of 2026. So I was talking about the white coat ceremony a little bit earlier, and I just wanted to show you guys a picture of this because this is just something fun that we get to do when we finally get into medical school, where we have a nice fancy event and everybody gets to walk across the stage and have their name announced in front of their family and friends, and we get presented with a white coat to symbolize that we are starting medical school and starting our journey of learning. And this white coat we keep for the duration of our medical school journey. And sometimes you wear it to like the hospital or to clinics or just to events and things like that. So it's just a fun little thing that you get. Going into what medicine actually looks like once you get there. So it's split into two different sections. The first section is where I am now. I'm in year two, so I'm in pre-clerkship. And then years in three and four, I'll get into in a second, but those are clerkship. So basically what pre-clerkship is it's a lot of classroom learning. It's very similar to what you do in your undergraduate degree, where you do a lot of lectures, a lot of classes, but then you also get to do more hands-on things like clinical skills, learning how to do physical exams, shadowing to figure out what kind of specialty you might want to go into, and start learning how to treat patients. And we also do a lot of simulations. So this photo here is just a photo of them doing a simulation. And then it's broken down into what's called blocks. So on the side here, you can see what all the different blocks are, and they kind of go by body system. So we start with foundations. I mentioned earlier that you can do your undergraduate degree in whatever you want to do it in. And that's because we have this block called foundations. So foundations, it assumes everybody starts at the same spot and it gets us all up to speed on all the science and baseline knowledge that we need. So you could know absolutely nothing about the human body coming in, and foundations will get you caught up so that everybody starts at the same spot. And then all the other systems are things like your cardiovascular system, so your heart, your pulmonary system, your lungs, renal system, your kidneys. And we just go through all the systems like that. We also, in first and second year, do longitudinal things. So we cover those things that make us just good doctors with good bedside manners. So we go through professionalism. This photo here is from something called the PI Project, which is a patient immersion experience. And the PI Project is basically where we get to talk to a patient. We get to meet with them 5 different times and go over just what it's like to be a patient who has chronic illness and what it's like to go through the medical system, things that went well, things that didn't go so well. And then we use that and we do an interpretive art project, and all of our PI mentors will come and we get to talk to them about what we learned and how we presented that to the community. And then after you finish years one and two, you go into clerkship. So next year, I will be going into clerkship. And this is where you actually get to go into the hospital and do your learning on the job. And so you go through different rotations of some of the more common things. Um, some of those things include like obstetrics and gynecology, which is where you're delivering babies and dealing with reproductive health, pediatrics, working with kids. You get to do a family medicine rotation, and the family medicine rotation is kind of fun because that's where you get to explore a little bit of your interest in rural medicine if you're interested. So everybody does 4 weeks of family medicine rurally, and then you have the option to do 8 weeks of family medicine rurally. And then you also have lots of elective time where you can choose to do rural electives. Um, Going into career exploration and electives, there's the required courses, but we're also given a lot of times to book things that we're interested in. A lot of that happens in third and fourth year, but you can definitely do it in your summers in between first, second, and second year as well. And you can do those locally, rurally, nationally. Some people even explore international electives if they're interested in going somewhere else. Something really cool that I'm going to be likely doing in my third year is I'm going to go up to the Yukon or the Northwest Territories to do an elective and explore not only what rural medicine is like, but what remote medicine is like, where you are a helicopter ride away from the nearest big center site like Edmonton. Once you're in medicine too, we care a lot about how you're doing. So we have a lot of student supports. The first one, the Office of Advocacy and Wellbeing, that is a program that is through our faculty, but separate for our faculty, and those are basically our advocates. So anything that we need, we can go to the Office of Advocacy and Wellbeing, and they'll help us figure out how to get it. Whether that be mental health supports, learning supports, financial supports, they will help guide you to make sure that you are doing well just physically, mentally, emotionally, and financially. The MD program as well, they provide academic support. They make sure that we have a mentor who is already a practicing doctor who follows us all the way through our program and make sure they can offer us advice. That's not somebody who's evaluating us, that's just someone who's there for us when we need them. The Faculty of Medicine and Dentistry also has community engagement initiatives where we get to talk with other people within our faculty and do a lot of things that need correcting, like underrepresentation in healthcare professions. And then the University of Alberta as well has other programs that we can look into if we need more beyond what our faculty can provide us. After you're done your 4 years of medical school, students then graduate with their Doctor of Medicine and they move on to their residency training program. What is residency training? I hardly knew what residency was until I was almost done my undergraduate degree and was about to apply to medicine. So, residency training is basically, again, kind of like clerkship, that on-the-job training, but in the specialty that you want to go into. So, whatever choice of specialty will determine the length of time it takes to complete the residency program. But the residency program is a paid program where you're learning on the job, and your fellow residents and also your practicing physicians will help you learn everything that you need to know to actually take care of patients. And so, if you're interested in family medicine, that's actually the shortest residency training that you can do. So, after you finish your 4 years of medical school, you do 2 years of residency on the job training. And then, if you want to go into something within family medicine, you can take 6 months to a year of extra training. So, for example, if you live in a rural community, a lot of the emergency physicians or the people working in emergency rooms are actually family doctors. And so, those family doctors took 6 months to a year of extra training so that they could also work in the emergency room on top of being a family physician. You can also train in surgical skills. So if you want to work in family medicine, but you also like working with your hands, you can take what's called an enhanced surgical skills program or an obstetric surgical skills program, which is just a year of learning how to do basic surgical skills like C-sections or appendectomies, which is where you remove your appendix, or tonsillectomies, where you remove your tonsils. And so you just get to be that family doctor, but also get to do a little bit of the surgery side of things. So I already talked about what the process is, but just a broad overview, once again, just so you guys know what you're looking at. So it is quite a long pathway, but it is so worth it if this is something you want to do. So once you finish high school, you get your undergraduate degree. Just a reminder that undergraduate degree can be in anything. You write your MCAT, and then you apply to medical school. Once you get into medical school, it's 4 years of medical school, and then you go to residency. Residency is anywhere from 2 to 5 years, depending what you want to do, with family medicine being on that 2 year side and surgery specialties being more on that 5 year side. And then you are finally a practicing physician. However, even though you're a practicing physician at the end here, you are a doctor as soon as you're done medical school. You just need to do a little bit more of the on the job training. If you guys are really quite interested in medicine, if everything I'm saying here sounds so interesting to you, but you just want to learn a little bit more, something that I would highly recommend that you look into is the Asclepius Medical Camp for Youth. This is a free week-long summer camp for high school students. It's primarily focused at people facing socioeconomic barriers, and it's just an chance for them to explore medicine and see if this is something that they would be passionate about. But I encourage you to apply no matter what your background is. There's two camps. One is done in Grand Prairie, roughly in the third week of July, and then one is done in Edmonton, and that's in the first week of July. If you're interested in going to Grand Prairie as well, and you don't live close enough to Grand Prairie to commute, or if you're interested to going to Edmonton, there are opportunities for you to stay at dorms there and be supervised by medical students. All of your people who are teaching you at this week-long camp are going to be current medical students. And then we also have guest speakers for all the sessions who come in for to teach their specific skills. So, for example, you'll get to do like suturing. So, we'll have a surgeon come in and teach you how to do stitches. I was a camp counselor for this last year, and it's under the same umbrella that MD Ambassadors is under, and it was such a good experience. I did both the Edmonton and the Grand Prairie camp, and we had students come in who were interested in medicine, and then also some students came in and they were like, we have an interprofessional panel where other healthcare professionals come in, like physiotherapists, dentists, psychiatrists, those types of things. We have all those people come in, and from coming to this camp, they thought they were interested in being a doctor, and they found out they actually wanted to do a different healthcare specialty, or they came in thinking, I want to do healthcare, but I don't know what. And then they did this camp, and they were like, you know what? I want to be a doctor. Follow on Instagram, asclepius.mcfy, if you're interested in going to the camp next year. It's such a good opportunity and it's so much fun, and it'll tell you a lot about the medicine specialty and everything that I'm telling you right now. You'll get so many more opportunities to dive deeper into that if that's something you're really interested in doing. Another thing that I want to talk about is the Society of Rural Physicians of Canada. So this is a union of rural physicians, specialists, residents, and medical students who are interested in rural medicine. So once you decide that you're going to medicine and you're in medicine, there's an opportunity to interact with them and go to these things called medical conferences where you get to spend a few days over one weekend in the year, and you get to go talk to physicians who are family doctors from all over Canada and learn about the different opportunities to practice medicine rurally. I went to the conference last year. It was in Winnipeg and it was so much fun. I met so many people. I met doctors from the Yukon, from the Northwest Territories, from the East Coast, from the West Coast, and everywhere in between. I even met some family doctors from New Zealand who came because um, we have a trade-off system with New Zealand where you have the opportunity to go practice in New Zealand, and some New Zealand doctors come practice here. Going into a little bit about my journey to medical school, just because everybody's journey is so different. Um, Sorry, let me just pull this up here. So I'm originally from a small town in Saskatchewan, but I did my undergraduate degree at the University of Calgary. I took a Bachelor of Science with honors in kinesiology, which, if you're not there yet, honors just means I did a research program in my fourth year. I then took 2 years off before I even applied to med school because I was playing on Team Canada for tackle football, which is what that photo on the right is. And then for work, I worked at the Alberta Children's Hospital as a research coordinator in pediatric emergency medicine, which is an opportunity that I got out of a volunteer position that I did during my undergraduate degree. I also did a little bit of part-time work as a personal care aide for an individual with cerebral palsy, just working in his house. And I volunteered at the children's hospital that I worked at doing ward relief, which basically meant that I would watch some of the younger kids so their parents could have a little bit of a break. Or if their parents couldn't be around, I'd go hang out with them so that they had someone to hang out with. So I did a lot of holding babies and playing with toddlers, and it was a lot of fun and so rewarding. And it's also really great for the parents as well. And I think doing volunteer opportunities like that, they're not mandatory to get into medical school, but it definitely showed me a side of the medical program that is what I really care about, which is that patient-centered care. I also volunteered doing some things that were just for fun and don't seem related to medicine in any way. I taught exercise programs. So, um, I did a seniors exercise program where I taught seniors how to do dance exercise, where we had a coordinated dance exercise class every single week with them. I also did an exercise program for individuals who are either recovering or actively in cancer treatment. And then I did an exercise program for kids with disabilities. So lots of exercise because I'm a very sporty person and I love getting active. Holistic health is something that's really important to me, and that's actually something I talked a lot about on my application. And then I also did a lot of advocacy work for people with disabilities. I briefly worked in a home for individuals with disabilities, and then I did private care for someone with disabilities. And then, other than that, I did a bunch of fun things like studying abroad in my undergraduate degree, volunteering in Brazil in between my first and second year of university, and I also was a manager at Boston Pizza briefly, randomly, which is actually a huge experience for me that I talked about a lot because if any of you do any work in a service industry, it's honestly really similar to being a doctor. It's a lot of listening to people, um, dealing with people's complaints, dealing with people's concerns, and then if something goes wrong, then you need to know how to balance correcting the situation and also making sure that person feels heard. So, working at a Boston Pizza is something I actually talked about in like 3 out of my 7 stations during my interview because it's just so applicable to just dealing with people, which is what being a doctor is all about. If I could give any advice to anybody pursuing medicine, I think my biggest takeaway now that I'm in medical school and I've talked to a bunch of people who are also in medical school is when you're pursuing medicine, you need to pursue what you love because those are the things that you're going to be able to talk about. My story involved working in healthcare a little bit, but what I actually ended up talking about most on my application was sports and exercise programs and traveling and studying abroad and my advocacy for people with disabilities. When you do what you love, it's just so much easier to share your story in a way that is meaningful and comes off as genuine. And so, even though it's important to make sure that you're doing things that you think are competitive for medicine, the best way to do that is actually just to do the things that you love and make sure that you can talk about them in a way that is meaningful. If you have any questions about anything that I said, I'm going to spend some time talking about questions right now. Or you can go onto the website at med.ualberta.ca. There's a really great frequently asked questions segment there. And most of the questions that you have, you can find it on there. There's a whole document just about the MD admissions process. Or if you find that MD admissions document and you still have some questions because you don't get it, you can email mdadmission@ualberta.ca. I will stop sharing my screen here. I'm once the chat is on and once I'm done answering questions, I will also give you guys my email for anything that was specifically in these slides, like the Asclepius camp. For most of your questions about the admissions process, I'll ask that you direct them to the mdadmission@ualberta.ca. But for anything about an opportunity in here or something I said that didn't quite make sense to you, or if you have a question about my own personal journey, I will give you my school email and I'll answer those questions for you as well. But Emily, I'm happy to take questions from the audience now.
All right, I see two questions that have come through so far. One question is, I have a question about the four-year undergrad requirement. Is there a specific undergrad that would make me better prepared for the MCAT? Would a science undergrad be more beneficial?
So I did a science undergrad, and I actually did not find my undergraduate degree that helpful in writing the MCAT. For some things, it was for sure. Like I didn't have much of a chemistry background going in, and so I took general chemistry, organic chemistry, and biochemistry in university. However, what I ended up doing because I took those very early on in my degree is before I wrote the MCAT, I got a set of MCAT textbooks and I had to completely reteach myself organic chemistry and biochemistry. And I actually found the way that the MCAT sources were set up, I found that easier than my undergraduate degree because um, the things that were focused on were slightly different. And then as well, your undergraduate degree is obviously over a full semester, whereas this is just one test. So they test you on a lot more um, surface level things. So you can take a Bachelor of Science, and it's helpful in some ways. If you have no sciences from, say, high school, it might be something that would be worthwhile. But you can also take any degree you want and use your elective time to do science classes if you need that background. But it's also totally fine if you don't do that and you just use the prep textbooks that exist. They're everywhere. You can find them on buy and sell Facebook Marketplace from anybody. Um, but yeah, I hope that answered your question. You absolutely do not need a Bachelor of Science. There's out of the 187 people in my class, there's about 36 people who did an arts degree before coming, so it is not mandatory. You can study for the MCAT other ways.
Awesome. It's so good to know. The next question here is, if we don't get accepted the first time into med school, is there a possibility to apply again? And if so, when can you reapply?
Yeah, so that's a great question. You can apply to medical school as many times as you want, and there's no timeline on when you have to apply. So, like I said, I applied 2 years after. I was very fortunate and I got in on my first time. Most people get in after between 2 and 4 attempts, so people definitely do apply multiple times. And there's some people who come from less traditional backgrounds who maybe didn't have super great grades and were super busy with family and stuff, so they didn't have a ton of extracurriculars who applied as many as like 7 times before getting in. That's not to be discouraging. That was someone who decided really late in life that they wanted to do medicine and didn't have a ton on their resume and just built it up over time. But it's just to say that there's no limit on how many times you apply. If you want to get into medicine, just keep applying until you get in, and you can apply as many times as you want, as many places as you want.
Awesome. The next question is maybe more of a personal question. How are you able to confidently pursue your undergraduate degree, being so far away from your family and community?
That is such a great question. So, I went to Calgary, which is about 7 hours away from where I grew up, which was a huge transition from small town to big town, and I didn't have any family in Calgary. And what worked for me is first off, I lived in residency in my first year of my undergraduate degree. And through that, I made some really awesome friends. And so I developed a support network of friends who were also in university at the same point in their life in me, which helped a lot. And then I always made a really big effort to head home for the holidays and for summers as well until I was more comfortable living on my own. So I went back to Saskatchewan for the first 2 summers after my undergraduate degree because I missed my family and I missed my support system. And then once I was later on and I got a little more comfortable, they started to visit me. And also, FaceTime is your friend. Call your family lots. I don't even know how many FaceTimes my mom took at 10 p.m. at night because I missed her and it was final season and I just wanted to talk.
Awesome. What are the major components that are included in the MCAT? And what can a high school student do to prepare for the MCAT?
Yeah, so for the MCAT, like I was saying earlier, there's four sections in it. So one is focused on biology and biochemistry. One is focused on physics, general chemistry. One's focused on psychology, and then one is focused on your critical reasoning skills. The critical reasoning skills is very similar to an English class. So I took AP English in high school and I found the cars section to be very, very similar to that, where you get a random block of text and it's on literally nothing to do with anything. I think one of my sections was on dinosaurs or something like that. And then you answer questions on reading that. And so I would recommend English classes if that's something that you struggle with is reasoning skills because doing those English classes will help. And then for everything else, you can either take an undergraduate degree class in one of those things, or there's these thing called MCAT prep textbooks, and it's basically a textbook that tells you every single thing that you would have to know on the MCAT. There's lots of hand-me-down ones you can get for like $40 on Facebook Marketplace, and it just goes through each different section. So there's a book on critical reasoning, there's a book on physics, a book on organic chemistry, general chemistry, all of those types of sections. And you work through them chapter by chapter, and there's a bunch of practice questions. And then online, you can do practice questions as well. The way most people do that is in between third and fourth year of their undergraduate degree if they're applying to medical school right away. People will study for one summer and then write the test at the end of summer. So you don't need to worry about prepping for it in high school. If you want to get that science background, that's totally great and that might make it a little bit easier. But most people won't even start studying for the MCAT until after their third year of university.
Awesome. How often can you write the MCAT if you're not successful the first time?
So for the MCAT, you can write it basically as soon as you get your grade back. And so once you get your ranking back and your score back, you can immediately book yourself for another test. And so you could potentially write like twice in 1 month, for example. However, I would definitely recommend studying in between if you weren't successful because you can only write the MCAT 4 times in your life. I don't know anybody who's written it 4 times. The most I've ever heard is three. Um, but you can write it as soon as you feel ready again. So if you wrote the MCAT and you're like, that was nothing like I expected, I was underprepared, you can write it as soon as you get your mark back and as soon as you've studied up and feel prepared.
Someone's asking, does it give more of a chance to get into med school if they have a master's degree?
Lots of people in my program do have master's degrees or PhDs, and lots of people don't. I would say about half of our class does not have a master's degree. People who are interested in medicine tend to do more school while they're waiting to get into medicine. So lots of people, if they don't get into medicine, will do a master's. But it's definitely not a requirement. It's again just one of those life experiences where it matters how you can talk about it. So if you are really passionate about a topic and you want to do a master's degree, you can do it and you can put it on your application and you can talk about it and that's great, but it's not a requirement. It is definitely something you could talk about in your highlights and your life experiences though. So I would do a master's if you care a lot about your master's, but don't do it just as something to get into med school because it is not a requirement.
What have been your biggest challenges so far in your journey of med school?
My biggest challenge in my journey to med school has been the moving around. So I moved to Calgary for my undergraduate degree, and then I moved to Edmonton for medical school. And then when I go to residency, I am probably going to move again, either to Saskatoon or Calgary again or Winnipeg. And I found that hard just because I drag my family with me. I'm married, so I drag my husband around with me. I drag my 2 cats around with me. I have a whole house to move. And then you move away with from your friends as well. It's really easy to make friends in medicine, so that part, it's obviously sad to leave my old friends, but I make a ton of new friends, so that's okay. But I would say the moving has been the biggest struggle so far. And then people don't talk about it a ton until you get into medicine, but if you're really passionate about pursuing medicine and you don't get in the first time, what you're going to do for 1 year while you apply again can be a little bit tricky to navigate as well because you don't want to put life on pause for medicine, but you also want to keep applying to medicine. So that can be a little tricky if you don't get in. I was fortunate that I got in on my first time, but I also applied to U of C and did not get into U of C. And I got that rejection letter 2 weeks earlier than I found out that I got into U of A. Um, or 2 weeks before I found out I got an interview to U of A, actually. So it was 4 months until I found out I got into U of A. And I had kind of just thought to myself, I don't know what I want to do for a year if I don't get into medicine. So that was something that was quite hard and something people struggle with if they don't get in the first time. But don't put life on hold for medicine. You can figure it out when it comes, I promise.
Awesome. How much studying is expected, and how do you balance this with you time and social time?
So for medicine, it's a little bit different than in your undergraduate degree. If you haven't done your undergraduate degree, your grades do matter in your undergrad to get into medicine. There are those cutoffs, and they are a little bit competitive. It's not the be all end all, but you do have to meet certain cutoffs for grades. So in my undergraduate degree, I studied quite a bit more. In med school, you still have to study, but because they want you to be able to explore your interests and be a well-balanced person, it's actually a pass-fail system. So once you get into med school, you need to study to understand the concepts, but you're studying to be able to put things into practice and to know where to find the information you need when you're actually in the hospital or in a clinic. And so you don't need to study until you know every single thing you've ever been taught. You'll learn that again and again when you're in clerkship and residency and when you're practicing as a doctor, and you'll learn where to find the things that you don't know. And so once you get to med school, it's med school, so it's still quite hard and you do have to study, but you definitely have that time to balance things because you don't need 100% on every test. You can get a 70 on a test and still be okay.
At what point in the process do you start earning an income?
So you start earning an income once you hit residency. So for medical school and for your undergraduate degree, you're not going to be making an income unless you have a job outside of those. Most people don't work in medical school, but in undergraduate degree, there's things like loans and bursaries and scholarships that you can apply for. And then once you get to medical school, there's lots of resources to help you pay for medical school. So um, for me, um, my background is my dad's a farmer and my mom worked in a restaurant up until a few years ago. And so I had no financial support going to med school. And so in my undergraduate degree, I worked to help pay for medicine. I worked in my summers, I worked in my evenings. And then once I got to medical school, there was so many supports in places for me financially that I was able to quit my job and just focus on school because once you're in medical school, they make sure that you can afford to be in medical school. So it sounds scary to not work throughout for 8 years, or if you work in your undergrad just for 4 years of med school, but I promise it's totally doable. There's a ton of financial supports once you're in.
Do you think coming from a rural background has been a benefit to you?
I would say coming from a rural background has definitely been beneficial to me. A lot of the experiences that I found once I got to med school that were really hands-on and great, I had those experiences rurally. And I think a lot of people who are from cities don't realize how great it is to go rural. And when you have all those optional opportunities to go rural and you don't realize and you don't have those experiences, you actually miss out on a ton of things. So in my second year, there's an option in medical school where you get to go into the community for 4 weeks and work in a hospital a full year before anybody else has the opportunity to work in a hospital. And I did that, and it was so great. And I got to work in an emergency department and deliver a baby and do all those cool things way sooner than my peers. And then also being from a rural background, I also just think there's a lot of things that you can talk about related to living rurally that you can really talk about in your interviews and in your applications. And so something I talked about living rurally is how close I was with my community. I talked about how I go to the grocery store and I run into 6 people who know me and 3 people who know my grandma and 2 people who know my mom, and how that is just such a great experience. And that's something I was able to talk about when I applied to medical school and talk about how that's why I want to go back to practicing rurally. And I think that's something that people in medicine like to hear is that you're so interested in caring for your community because when you're a physician, that's your job is to care for your community. And so being from a rural background, you get to talk about how you have close connections to your community that you don't always get in a big city. So I would say that it definitely was something that was big on my application.
Thank you so much, Chantel. I really appreciate the time you took to present to us this evening, and I'm sure you have inspired at least a few students here to consider a career as a family physician.